Hi, this is Dr. O here, and thanks for tuning in to Ask Dr. Orbeck. I want to make sure you don't miss a single episode of the show on YouTube, so before we continue, be sure to subscribe to our channel and ring the bell to get notified about our latest videos. If on your phone, just go into the settings and switch on notification. Thanks so much for watching. Hello everyone, and welcome to my monthly live stream, Ask Dr. O. This is where I address common questions that I get from patients in my practice here at Regenerative Medical Institute in Greenville, South Carolina. At RMI, I specialize in areas of metabolic and rejuvenation medicine. We emphasize on sexual wellness and intimacy. Today we're going to talk about some common questions I get related to how sex changes as we get older. Remember, you can always visit my website, rmi.live, for more information and to book a consultation. But for now, let's get started on this week's question. So the question of the week is, how common are sexual problems as we age, and what do people typically experience? Sexual intimacy is a vital part of your well-being. An active, satisfying sex life strengthens your marriage, it strengthens your partnership. Intimacy also offers many health benefits. This includes improving your heart health. Unfortunately, age-related health problems often make intimacy a real challenge. And we all know about that as we reach our 40s and our 50s. Let's first start talking about the male population. So in men, age-related sexual problems are quite common. With age that include low libido, libido starts to decline as our hormones start to decline. Erectile dysfunction is also a real issue. This is called ED. About 70% of men over 70 struggle with erectile dysfunction. Studies have shown that your risk of ED increases by 10% during every decade of your life. Men can also have male orgasmic issues, ability to climax, or premature climax. Men can also have difficulty with retrograde ejaculation. These are all the issues that I deal with RMI as men begin to age. Let's now talk about women. It's not just men who struggle for sexual intimacy. Women are also very much involved in sexual dysfunction as they age. Female sexual dysfunction is estimated to affect more than 70 to 75% of women right in their middle age peak of 40 to 50. This is where sexual wellness should be at its prime. During their late 40s, women experience major hormonal changes as they approach menopause. And menopause has a significant impact on your sexual health. Menopause symptoms often include low sexual desire, vaginal pain and dryness, difficulty achieving an orgasm, and overall vitality. What can be done to treat problems that we described above? What kind of results do people typically get when we use treatments for these problems? Let's talk about that now. The symptoms that we did discuss can have a profound impact on patients' quality of life. Yet, many people believe that these symptoms are just an inevitable part of aging. Please don't think that way. Most intimacy problems can be resolved with the right kind of care. At RMI, we offer a comprehensive intimate wellness treatment program. We go over your symptom score, we look at your laboratory work, and then we reevaluate. Regenerative medicine can rejuvenate your sex life. With cutting-edge treatments, patients can experience improved intimacy, joy in their life. So let's discuss some overview of treatments here at RMI that we do offer. And the first I want to talk to you about, and I actually just did one about 20 minutes ago before this live stream, and she did very well, is called platelet-rich plasma, PRP. PRP therapy utilizes platelets and growth factors found in your own body to stimulate your own healing. What I love about PRP is I'm a regenerative medical doctor, and I love to use different types of issues, or I like to use different types of substances, I should say, that actually can regenerate you. I like to use natural regenerative compounds. PRP comes from your own body, so you're not allergic to it. Now let's talk about men. The P-shot is a concentrated solution that boosts blood flow to your most intimate areas. The P-shot involves taking a patient's own blood platelets, injecting them into the penis. It actually goes right into the corpus spongiosum to activate growth factors and rejuvenate the penis. This allows more blood flow to the organ. It enhances more sensitivity, and delivers enduring improvement in sexual function. So the benefits of the P-shot can include more firm erections, more lasting erections, improved sexual stamina, increasing sexual sensation and pleasure, and increased blood flow and circulation. So these are just some of the benefits of PRP, and I often see these on a regular basis when I offer this procedure. Let's now talk about women. As we just discussed, a large amount of women can have sexual dysfunction as they reach their middle age. The O-shot is a concentrated solution that boosts blood flow to your most intimate areas. The O-shot procedure begins with a blood draw. Then growth factors and platelet-rich plasma are extracted from the blood sample and injected into the area near the clitoris. I actually go next to the clitoris and down into the root of the clitoris, and then the area of the upper vagina, known as the O-spot. That is the most important area for the sexual response. The process takes less than 10 minutes to inject, and my patients are typically with me for about 45 minutes with the entire procedure, including the blood draw and preparing the platelet-rich plasma. It's done in the doctor's office and causes little to no discomfort because I use a powerful numbing cream, which is a local anesthetic, at the area to reduce any pain. Let's talk about the benefits of the O-shot. The O-shot can give you a tighter vaginal opening. It rejuvenates tissue. It regenerates tissue. It can give you a stronger and more frequent orgasm. It can also give you multiple orgasms. Increased sexual desire can occur, and well as decreased vaginal pain. I often find that my patients have increased vaginal lubrication, so it really helps in vaginal dryness. And one big benefit I also often see with the O-shot is urinary incontinence improves. As women age, they can lose that ability to hold the urine. When they go to the gym, they get embarrassed or they may be using pads. So urinary incontinence can become a problem. The O-shot has been a tremendous benefit in my practice for urinary leakage. So most patients who receive the P-shot or the O-shot report improved sexual performance as well as satisfaction. Now let's talk about bioidentical hormone replacement therapy, or Bhrt. I offer bioidentical hormone replacement therapy here at Regenerative Medical Institute. I use it through my practice, Body Logic MD of Greenville. These hormones are derived from natural sources and are biologically identical to those produced by your body. So there's a lot of difference between synthetic hormones and bioidentical hormones. They help restore your body's natural hormone balance. Bioidentical hormones can boost your sex drive. They can increase your sensitivity and performance. They can relieve depression and anxiety. They can also improve your sleep quality and ability to sleep through the night. They've been shown to reduce hair loss, improve memory, energy, as well as stamina. Bioidentical hormones are really the foundation of my practice in regenerative medicine. Hormones are cell signals, very important, and tell the DNA what to do on each cell and how to make protein. So cell-to-cell communication is very important in bioidentical hormone replacement therapy, giving the body what it's lacking. Let's talk about some other treatments. At RMI, we offer a full variety of different treatments in addition to O-shots, P-shots, and hormone therapy. We offer treatments for intimate wellness that the body can rejuvenate, which is non-invasive treatments. And I'm going to discuss these options with you now. For men, we offer a pump. This is a water pump or a Hydromax pump, which is a penis pump that is highly effective. I ask my patients to use it daily. And according to the Mayo Clinic, with practice and correct use, the majority of men can really get an erection sufficient for optimal sex. Let's talk about now acoustic pulse wave therapy, or APWT. I also did this procedure this morning. I love this procedure because it is really non-invasive. It doesn't really utilize any type of pharmacology. It's a pressure wave therapy using acoustic waves that enhance blood flow circulation into the penis. That leads to improved erectile function, increased stimulation, and decreased pain. I also like Cell Matrix MD. This is a cream, which is an orthomolecular transdermal cream that can treat ED. I use this to rub on the penis for prostate health on the anterior penile shaft, And then I use it basically for ED by placing it on the scrotum or the penile head. We also use peptide treatments here at Regenerative Medical Institute. I love peptides. They're the new kid on the block, and they're very safe with very minimal side effects. Now let's talk about women. With women, after the O shot, and even if you don't have an O shot, I often use intensity and apex devices. These devices help strengthen the pelvic floor without surgery. It actually acts as kind of like an electrical nerve stimulator along the Kegel muscles so that you can tighten your pelvic floor. I use Votiva by InMode, and I've gotten a lot of good results from Votiva. Votiva is a non-invasive procedure. It uses radio frequency energy. I like radio frequency because I feel it's a little bit more safe than laser. So radio frequency energy is introduced in the vagina at a pulse and addresses internal and external vaginal issues, including vaginal rejuvenation. The outcome is usually a tighter vagina, stimulation to the vaginal mucosa. It reduces urinary incontinence and helps sexual performance. In women, I also offer peptide treatments. And like I said before, peptides are a real nice option over pharmaceuticals. So in close, if you have any questions related to regenerative medicine, PRP, male or female sexual intimacy, or anything else, please leave your questions in the comments, or you can submit questions to the email producer, katie@dnaagency.com. So we've touched on a really difficult subject. Most people don't like to talk about it, but sexuality gives you quality of life. Please don't shun away from it. Ask these questions. Be active. Talk to your doctor. That's all for today, guys. I'll be back next month for another round of questions. You can visit my website at rmi.live for more information on any of these things we talked about today or to schedule a consultation. Thanks all for watching. This is Dr. O signing out. Hi, this is Dr. O here, and thanks for tuning in to Ask Dr. Orbeck. I want to make sure you don't miss a single episode of this show on YouTube, so before we continue, be sure to subscribe to our channel and ring the bell to get notified about our latest videos. If on your phone, just go into the settings and switch on notification. Thanks so much for watching.